we talked about the viruses, right? That I think that's what we finished with, as far as I remember. So the viruses that infect skin, we kind of started with two viruses that bear the similar name, the chickenpox and the smallpox. They have nothing in common. They're not related. Chickenpox is the herpes virus, and smallpox is the pox virus. Chicken both have vaccines against them, but remember we discussed smallpox. Our smallpox virus is eradicated now. It does not exist on the face of Earth, which was actually the first virus to be eradicated, okay, in 1977. We do have two stockpiles of vaccinia virus, oh, sorry, of smallpox virus in Atlanta, Georgia, and Novosibirsk, Russia. And actually, there's a debate now whether we should destroy this stock, whether we should keep it. And I don't remember if we discussed it. I think we did a little bit, why we should keep it or why we should not. It's actually still an open question. So this kind of summarizes here the organism that causes is each of the infections. The transmission, okay, you see that what they have in common is that the transmission can be via respiratory route or via direct contact. Virulence factors, don't focus on them, okay? Don't really focus. Culture diagnosis, clinical appearance. Now here's the trick. I think we discussed it a little bit before. A lot of physicians actually never saw smallpox and chickenpox. Well, I would say all physicians here in the United States that are currently treat us never saw smallpox, and quite rarely saw chickenpox because it virtually is non-existent due to the people vaccinating kids. There is no, well, treatment again, since smallpox is gone, we don't really know what to treat it with. For chickenpox, there is a cyclovir, right? So we can do a cyclovir as for any herpes virus, although it is not warranted for people with normal immune system. If there is an immunocompromised patient, then a cyclovir may be warranted. So pretty much the pustular rash is the distinguishing feature of it. Now the next infection that is actually very much worth to talk about is measles. It's also called the rubeola. Belongs to Paramyxoviridae, the negative strand RNA virus. You will actually notice that a lot of the viruses are, a lot of pathogenic viruses are actually RNA viruses. So measles is probably the most contagious virus that we know. I brought up the example before, the comparison before. If you walk into the party room, there are 200 people, and close the door and you'll start to party, and after 2 hours all 200 people are going to be infected because you talk, you breathe, and you produce aerosol, and you produce aerosol with measles if you're infected, and it's extremely contagious. The only reservoir for this virus is humans. So this is a very important thing. We just discussed another infection for which humans were the only reservoir. What was that? The only animals that are infected, humans, measles, and something else that we just talked about, just smallpox. So what did we do with smallpox? And eradicated. And why could we do that? Exactly, because we can control it, Humans are easy to control, right? So measles is essentially the next candidate to be eradicated. So why can't we do that? Well, because of Andy Wakefield. We talked about this gentleman, the British, used to be a doctor, who suggested that this vaccine causes autism, the measles, mumps, and rubella vaccine, which is actually highly effective. It doesn't. But since then, the number of vaccinated people started to decline, and measles still circulates in the population. The skin manifestations is the Koplik spots, the rash, okay, which doesn't seem to be very severe, but think about this. MMR vaccine has to be boosted, okay? Children are given several doses, like at 6 months, 1 year, and something else, and sometimes later. And if vaccine didn't work in one particular case, which absolutely can be, the child is at risk of acquiring measles. And for 6, 7, 8-month-old child, measles poses actually a death threat. A family personally knows a mother who vaccinated her son, and he died because apparently either vaccine didn't work or immunity didn't kick in completely. He acquired measles and died of measles. And it's a developed country, it's a great healthcare system, but it didn't work for some reason. So it's really, really important to vaccinate to stop the transmission. Okay, and another complication that can arise from the measles infection is subacute sclerosing panencephalitis, which I understand is the tongue breaker, but SSPE is the brain infection. Measles virus can actually migrate across blood-brain barrier, sometimes affect neurons, and it's very slow developing disease. Symptoms may arise years, like 8, 10, 15 years after the initial measles infection. And if they are not diagnosed timely, there are several stages of the disease. If they're not diagnosed timely and the disease enters like a third stage, then it is absolutely untreatable and it's 100% lethal. It's a slow brain deterioration, which is not a very good perspective. Okay, so this is another statement here. You can see low coverage, resurgence of the disease. What does that mean? Multiple studies have demonstrated that when vaccine coverage decreases, and you can see there's the vaccine coverage is exemplified here on the right. Okay, the lower the coverage, the darker the color, the darker the blue. You can see that's, I just can't read, you can barely see, but this is less than 80%, and this is more than 95. So you can see the darker spots represent the lower vaccine coverage. Does that make sense? This is in Netherlands, okay? Among the Orthodox Jewish communities. I mean, it's among all the communities, but lower vaccine coverage corresponds to the areas where extremely Orthodox Jewish communities live, and they cannot vaccinate based on their religious beliefs. Well, guess what? You can see how well the lower coverage corresponds with increased numbers of cases of measles. The minute you drop the coverage, measles immediately starts to question. Absolutely. That's a great comment. It is a herd immunity. When vaccination coverage drops, due to the contagiousness of the disease, it immediately starts to spread. You need pretty much 1, 2 infected people to have an outbreak. Okay, and that's the problem is, even if the person, even, most of the people who are infected with measles don't die, of course. But you never know whether you're going to be a lucky, quote unquote, person who will develop the panencephalitis later. Does that make sense? Another complication of measles infection that we talked about before a little bit is that measles infects B cells, essentially rendering you immunocompromised for about half a year. And you can imagine, I mean, you're not going to be completely without immunity, but your antibody levels, and it doesn't mean that you don't have B cells at all. The level's just extremely low. So antibody production is low, right? Antibodies are low, and bacterial and viral infection. So it turns out that measles vaccination does not only protect you against measles, it decreases your risk of developing a secondary infection after the measles, right? So it's much more important than we thought it is. Rubella, it's actually the third virus disease completely eradicated in North America, United States, Canada, and Mexico. So the first one is smallpox. Second is rinderpest, which is an infection of cattle. And the third is rubella. So I'm going to eradicate it in North America. Okay. It's also called the German measles. Belongs to the Togaviridae, the same group of viruses to which Western and Eastern equine encephalitis, pretty severe diseases, belong. It's a positive RNA virus, single-strand positive, okay, but still RNA virus. And in adults and in children, it causes a relatively mild disease, although in adults it usually causes more severe fever, more severe malaise and general not well-being. But for immunocompetent person, it does not pose a serious threat. In children and adults, both of them recover fairly easily. Respiratory transmitted, but what I want to specifically focus on is the vertical transmission. It's one of the most dangerous infections for pregnant women. The transmission can be congenital, okay, or postnatal. And both of these infections can cause severe complications in newborns. But it seems like congenital infection, the one that is acquired by the fetus during the pregnancy, causes the most severe abnormalities. Generally speaking, rubella virus infection during pregnancy is almost 100% guarantee that fetus, the newborn, is going to have one or another problem. And it tends to be quite severe problems, the developmental retardations, cataracts, microcephaly, all kinds of problems, okay? So this is what, the injury actually will depend on which time during pregnancy infection is acquired and transmitted. That is why it is extremely important for a woman before becoming pregnant, make sure that she has vaccination against rubella virus. Because although we don't have the virus in the United States, you understand that, by traveling to other countries or being exposed to other people, you still may have not the autochthonous transmission, but you may acquire the imported case. Okay, that makes sense? These two viruses are fairly benign, the parvovirus B19 and Roseola virus. Parvovirus is single-strand, small, non-enveloped DNA virus, which is transmitted by respiratory route and causes very characteristic slapped cheek appearance on children, also called fifth disease. Yeah. Okay, the fifth disease. Fever, malaise, doesn't seem to be associated with any long-term complications, but the latest studies, epidemiological studies of virus infections actually suggested that maybe parvovirus B19 can be associated with cardiovascular disease. Of course, the association is somewhat questionable, but you have to appreciate that how do we study that? We'll look at the cohort of people with CVD, cardiovascular disease, and without, and we'll look at the antibody levels to parvovirus B19, and we see that in patients with CVD, they have generally either higher levels or more of them have antibodies rather than patients without CVD. So there's a positive correlation between the infection with parvovirus B19 and cardiovascular disease. Does it cause it? Probably not directly, but does it increase risk? Maybe. That's the problem with epidemiology. You have to observe population for years and years. Roseola. Contact transmission. Okay. Although, since it's a herpes virus, actually two herpes viruses that can cause this infection, it is also likely that it can be transmitted by the bodily fluids like saliva and urine. That's what children do. They exchange fluids in a daycare setting. So anywhere they are, they just exchanged. And as any other herpes virus, Roseola virus establishes latency. So once the child is infected, and it is present with a multiple blotched spots, the rash, that goes all around the trunk. Once it establishes latency, every time the child becomes, or adult, becomes immunocompromised, this infection can actually reactivate, and the spots, the rash, can actually appear more or less concentrated around the waist. It is often mixed up with measles or rubella and causes parents to freak out because they think, what's going on? We were vaccinated. We shouldn't have this infection. Although we don't have vaccine against roseola because it doesn't seem to cause any detrimental effect, except that this rash can be kind of itchy. Other than that, it is fairly low morbidity infection. Does that make sense? So this is the summary of the maculopapular rash diseases, the scarlet fever that we discussed before, and the 4 viral infections. The next thing we'll talk about is warts. So this is the growth of the keratinocytes, the skin cells that are infected with papillomavirus, which is the non-enveloped double-strand DNA, fairly lazy and slow-growing virus. Now, what happens? So, virus contains DNA, right? Double-strand, and it has to replicate, right? Virus has to replicate, it has to multiply in the cell, and it infects keratinocytes in a basal layer of the skin, of the epidermis, stratum basale. Cellular DNA. When does it replicate? cellular DNA. Not where, but before which act. So DNA replicates. Why do we need to replicate DNA in a cell? So cell can, yeah, cell can divide, right? Cell can go through mitosis, right? Now, it's kind of convenient for a virus that it has double-strand DNA because it can use the cellular replication machinery to replicate its own DNA, right? The only thing is that virus has to constantly push the cell to divide. Does that make sense? Every time cell divides, virus replicates. Every time cell divides, virus replicates. So virus has to remove the brakes from cell growth process, pretty much from the cell cycle. Because if you remember, cell cycle has several phases. Okay, you have G1 as G2, and then you have mitosis. And there are arrest points when cell just kind of stops doing anything, kind of dormant. Okay, so virus removes those brakes, and cell constantly divides, and virus replicates. Now, when cells divide, you have the growth. Okay, more and more cells are produced, and you have a wart. Does that make sense? The skin growth that are caused by the papillomavirus are benign. Although, when certain subtypes, most prominent are 16 and 18, infect the epithelium of the cervix, which is, I want to remind you, stratified squamous, right? Most of the vaginal epithelium is stratified squamous epithelium. When they infect and they stimulate the division, sometimes that division leads to the formation of the cervical cancer, not benign growth anymore. One very important thing that I want you to understand: oncogenesis is not required for virus replication. I even write this here, okay? And I'm gonna highlight this, okay? It's not required. It's a bystander effect. Do you understand what I mean? Do you understand what I mean by bystander effect? It's an unfortunate, exactly, it's an unfortunate consequence. These viruses can perfectly fine grow without oncogenesis, but their replication leads to oncogenesis. Does that make sense? So most recently, the papillomaviruses, which we assign as HPV, is associated with the head and neck tumors. Again, this is association. Now, treatment for the warts: cryosurgery, liquid nitrogen. I don't know if you ever removed warts. I did. Cryosurgery sucks. If you ever to remove warts, ask for laser treatment. It's much faster, much more effective. Pretty much burn it to the ground, just destroy it completely with all the virus around. Freezing it works poorly. Okay. Leishmaniasis. Another quite an interesting infection. It's actually a protozoan infection, a zoonotic infection that is transmitted by sandflies. You can see Leishmania parasites here. We call these parasites promastigotes. Anyone remembers what mastigote, mastigophora means? it has something. Huh? Not silly. Flagella, yes. You can see tiny flagella here. Here it's a, so this is a fascinating parasite that goes through several stages, flagellated and non-flagellated stage. Okay, um, it's present all over the world, Southeast Asia, Africa, actually South America as well, and it can cause different forms. So depending on um, the depth of penetration, let's put it this way, how invasive the microbe is. It can cause cutaneous leishmaniasis. You can see the leishmania wound on this picture. It can cause spondia, which is a mucosal lesion, or systemic. Okay, so cutaneous is fairly mild, and it's pretty common in South America. I had a student last semester, yes, spring and summer. She spent about a year in Peru as a part of the Peace Corps, and she said that it was like warts there. It's so common. Spondia is pretty common too, but spondia can be fairly disfiguring infection because it causes wounds and destruction of the mucosal surfaces. It may cause really, really large and bad lesions in nose and mouth and so on. Systemic leishmaniasis, which in India also called Kala Azar. You don't have to know that, just it's something like a black death or something. This is an extremely severe disease which affects virtually all organs and frequently leads to death, very high morbidity and mortality. There are treatments available. We don't have a vaccine against leishmaniasis, but we do have treatments. So antimonites, which is highlighted here, sodium stibogluconate. So it's pretty much a compound that contains antimony. Okay. As you can imagine, antimony is chemically related to lead. So you can imagine that sodium stibogluconate is extremely toxic. Effective, but toxic. Less toxic treatments include amphotericin B and fluconazole, which, as you may remember, are antifungal drugs. So since antifungal drugs target eukaryotes, they kind of have a broad range here. So absolutely, amphotericin B and fluconazole are still fairly toxic, right? But less toxic than antimonites and effective in treating leishmania. So in developing countries, in some of them, antimonites are still used, but more and more local clinics switch to these drugs. Another eukaryotic infection of the skin, the ringworm, is neither ring nor worm. It's a fungus. You can see a number of manifestations in these pictures, okay? And this infection, when we say ringworm, it actually can be caused, these symptoms can be caused by a variety of fungi, including trichophyton, microsporum, epidermophyton, and Tinea versicolor, which is this. It's usually called by Malassezia forfar. Well, not only forfar, I really like the species name. It's spelled forfar. But Malassezia in general, the genus Malassezia. So what happens is, depending on where the infection is, it bears different names. For example, the infection of the scalp is called Tinea capatis, to the scalp. Tinea barbi is on the beard. Tinea cruris is the jock's itch. It's in the groin. Tinea pedis, the leg. So, in essence, it's the same infection. And tinea means worm, but as I mentioned, it is not. So treatment for this is the topical antifungals. Mostly if you go to a physician with that condition, they will provide you fluconazole or ketoconazole creams. Sometimes if it doesn't go away, they will give you an oral antifungal, maybe a combination. But it is fairly easily treated. Now, if you think about this, well, it's a contact transmission, but what are the most common manifestations among pretty much all adults? Groin and feet. Because of what? It's warm and it's wet. Sweaty, right? So if you eliminate one of those, well, I'm not suggesting putting your legs on ice, okay? Or stuffing, eyes in the underwear, but pretty much keeping a proper hygiene and avoiding exchange of underwear, okay, will keep you pretty well protected against this infection. And one of the common places where it is transmitted is what? Locker room, right? Because it's wet, it's warm, most importantly, wet. There's a lot of epidermis lying around there. Okay, so when I was a kid, I actually was in a swimming team, and before you being admitted, allowed to go in a pool, you have to go through. Have to get a doctor's note, and they will check your feet, and they will state that you don't have athlete's foot. And nevertheless, I acquired one, and it took me 2 years to get rid of it. So it's really a long process because we did only topical treatment, and it's on and off, especially if you go to the same locker room. Okay, so it actually acquires. Now, as far as I know, they start to treat tile floors in the locker rooms with the special compounds that sort of inhibit the growth of the fungus, so limiting the spread. Okay, the eye infections. So eye anatomy. So eye is generally an immune privileged site, which means that there's not a lot of circulation there. And in fact, if you think about it, circulation through the cornea is completely absent, as is through the lens. Circulation is only through the choroid here, okay, and a little bit through the retinal vein and artery. But most of the eye is not reached by the blood, which means there are no white blood cells to get there. So it is not under immediate immune surveillance from your cells. Does that make sense? This is a very important feature of an eye. Okay, so the structures of an eye that are most exposed to pathogens are the conjunctiva, and I want to remind you what it is. Okay, so conjunctiva is the layer that covers the eyeball up front, and it also covers the internal surface of your eyelids, right? The palpebral conjunctiva and the bulbar conjunctiva. And cornea is not covered with conjunctiva right here, okay? But it is still exposed constantly to the outside world. Of course, these surfaces are protected by mucus. Conjunctiva is the mucous membrane, so there's IgA. There's, of course, lysozyme that is in the tears that constantly wash your eye. Okay. There is sparse, although present, microbiota, different types of staphylococci and Crinibacterium. But generally speaking, your eye overall is not exposed to the immune system. So for a lot of microbes, there's somewhat of a safe haven. The outside structures, the conjunctiva, when it becomes infected with either virus or bacteria, develops the disease that we know as conjunctivitis, inflammation of the conjunctiva. That's usually manifested as redness, purulent secretions. Purulent means what? Purulent. Anyone knows the word purulent? Pus. It means that there is a pus formed. Like, you know, when people with pink eye, they actually produce a lot of that whitish thing. Kids with pink eye, they sometimes in the morning, they can't even open their eyes because the eyelids are stuck together by the pus. This is called a purulent secretion. It consists pretty much of dead bacteria, dead neutrophils, and dead macrophages. Okay. The most common cause of conjunctivitis. In neonates, you see, it's the, sorry, brain freeze. Sexually transmitted infections. Chlamydia trachomatis and Neisseria gonorrhea. Chlamydia is the most common sexually transmitted disease in the United States. And often it comes undiagnosed, okay? It comes asymptomatic, and the child can acquire it while going through the birth canal, as well as gonorrhea. Gonorrhea can also be asymptomatic, not frequently, but can be in females. So obviously the mucous membrane, the eye, when it is exposed to that bacterial infection, can quickly develop this infection. Because generally speaking, Neisseria gonorrhea, Chlamydia trachomatis don't really care on which mucous membrane to reproduce. Does that make sense? It can be treated fairly easily, okay, with antibiotics. In adults, bacterial conjunctivitis is caused by a number of gram-positive and gram-negative infections, bacteria. You can see that it involves strep pyogenes and strep pneumonia, Staph aureus, Haemophilus influenza, Warts. Now, what I mentioned now, we didn't talk about them in very much details, but we talked about Staph aureus before, and we surveyed ourselves about Staph aureus. Where did we find it? Staph aureus. Remember, we surveyed this class for the presence of Staph aureus. Where did we find it? That's Staph epidermidis. Nose. Respiratory. Yes. In the respiratory system. Now, it's only conceivable that you can just transmit this from your nose to your eye, right? So all those gram-negatives that I mentioned, the strep pyogenes, strep pneumonia, Staph aureus, H. influenza, Moraxella catarrhalis, they all are respiratory pathogens. Okay? As well, Neisseria gonorrhea, Chlamydia trachomatis. In case of, awful hygienic habits, those sexually transmitted diseases can actually cause infection of the eye. Again, these infections can be fairly easily treated. Usually it is ciprofloxacin, the broad spectrum antibiotic, okay, that is prescribed in the form of eye drops. Viruses can also cause conjunctivitis. There's no purulent secretion in this case, just inflammation. It's fairly rare, okay, and virus infection, you cannot treat it. You just have to wait for it to pass. Okay. That makes sense? Okay. Now, this is a characteristic infection of the eye that is called trachoma, caused by Chlamydia trachomatis. It's a gram-negative intracellular microbe. When inflammation ensues, the neutrophils and macrophages, they cause this pebbled appearance. See, like pebbles of the conjunctiva. It also may cause a formation of pannus, the pseudomembrane. So eye slowly becomes obstructed by the pannus, by the pseudomembrane. If untreated, trachoma can lead to blindness in children. Again, now we have very effective antibiotics, but at a certain point, the number of trachoma infections in newborns was so high that a trachoma vaccine was seriously considered. It was so high to eliminate the spread of chlamydia in the population. Now, those were infections of conjunctiva. Infections of the cornea, because the pathology that we know is keratitis. So keratitis is fairly frequently caused by herpes simplex infection, which is not common among immunocompetent, but pretty usual in AIDS patients. Herpes simplex virus is usually latent and it resides in the neurons. But once immunity is compromised, like in AIDS patients, the virus starts to replicate, and if it gets into the eye, it pretty much infects the epithelial cells of the cornea and destroys them and causes corneal claudication. Now the antivirals are used, but they not extremely effective, because usually the diagnostic of this infection is based on the clinical symptoms, and at this point the damage is already done. So at a certain point it can the corneal transplant can be warranted. Another very common cause of keratitis is amoeba. Now, amoebic infection is, we would call it non-communicable infectious disease. What happens is people who wear contact lens, when they don't have access to the lens storage solution, they sometimes use tap water, which is not the greatest idea because amoeba can be residing in the tap water. It doesn't cause any other type of infection, but if several microorganisms end up on the surface of the contact lens and they become trapped between the cornea and the contact lens, right here in this little trough, right? If they become trapped there, then they start, well, they have to leave, they have to eat something. And what is the only available source of food? Corneal epithelium. So they start to munch on the corneal epithelium, right? Does that make sense? There you go. And it's a fairly slow process, and often at the time when it is diagnosed, it's too late and there's a need in corneal transplant. My favorite, river blindness. A little plug for helminths. Why I love helminths so much? They represent a great example of how ecology, lifestyle contribute to the spread of the infection. How infection can be controlled, often not by the drugs, by the use of proper, say, agricultural practices, or by the control of vector. By the way, going back to Leishmaniasis, just reminding you, we talked about Leishmaniasis a little bit. Look, scent flies, right? So how can you control effectively? Well, use the spray. By the way, scent flies are very close relatives of mosquitoes. So control the vector. Why we now have so many vector transmitted, arthropod transmitted infections? Anyone can tell me? It actually, a huge outbreak happened about after like 60s. We stopped using something. Yes, we entirely stopped using DDT. I'm not saying that we have to go back to it. No way. But it turns out, how did we use DDT? Does anyone know? Yeah, there was a plane that sprayed DDT. So it sprayed it on mosquitoes, on plants, on people, on animals, and it does cause a lot of neonatal problems. It is carcinogenic and whatnot. So we stopped using it, and immediately the vector-transmitted diseases started to spread. And it can be used now, just in a different fashion. You can use DDT, for example, by kind of spraying or applying it to the window sills, window frames. I don't think that people frequently lick window frames or rub their skin against it, right? So if it is used in a very controlled manner, it's extremely effective in controlling the mosquitoes getting into the house, okay? So at least in the house, people don't get exposure. That makes sense? So there we go. Now this is an infection that is transmitted by black flies. Common in Africa. We pretty much can say it is in Africa. It's caused by the nematode. You can see the adult worms here. Onchocerca volvulus. As far as I remember, although I wouldn't take my words to the bank, in this case, black flies are not the biological but the mechanical vector. So microfilaria resides in the fly, just waiting to be transmitted to humans, right? However, when it enters the circulation, it starts to grow. You can see initially it causes the skin manifestations, okay? But then it migrates from the skin into the surrounding tissue, and it grows, and it grows, and it grows, and it, in some cases, can reach the length of about 6 feet, although being very, 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 very thin. And those worms eventually end in the eye. Frequently, the diagnostics, you can see the worm right here. The diagnostics of the infection can be done by the patient, him or herself, when they see the worm floating across the eye. I mean, not in the mirror, because it floats through the eye, crawls through the eye. They can see something is crawling, right? Because it's in front of the retina. So if it is not treated properly, then the worm causes the permanent eye damage and inevitably leads to blindness. So if this infection is acquired during the childhood or early puberty, by the age of 28, 30, the man is blind, the woman is blind. There were entire villages in Africa where people above certain age were ultimately blind. But President Carter, well, former President Carter, established Jimmy Carter Foundation, and the aim was to eradicate river blindness. Because you can imagine how devastating this disease was on the economy of the regions. When you're blind, you have hard times working anywhere. So they negotiated with Merck that Merck will supply the drug ivermectin. Was the reason Bill Campbell and one Japanese dude got the Nobel Prize last year. Okay, drug ivermectin for pretty much the entire Africa for free, because Merck actually, and you can imagine, Merck would not do it without hoping to make money off that drug. You know who pays for that? Who pays for that free supply? You shouldn't feel bad, by the way. I mean, do you have dogs? Anyone have dogs? Treat them for heartworm. That's ivermectin. That's what Merck makes money from. The veterinary ivermectin. Well, I mean, of course you can buy it, but in Africa it is supplied for free, and it's one pill a year. Because ivermectin, I will remind you, it paralyzes the worm. It doesn't kill it, but worm becomes paralyzed. And when the worm is paralyzed, it's awfully hard to do something. Any idea what? Huh? Now, oh yeah, that can survive without eating for a long time. Yeah. It's really hard to find a mate and replicate when you're paralyzed. So essentially, the drug has to be given for about 20 years, because the highest lifespan, possible lifespan for the worm is 20 years. Eventually, it will just die. Does that make sense? And of course, control of black flies. Okay, that was the vector control. So we're going to finish with this one now.